Thank you, Chairman. Thank you, organizers. Good morning. Today, I would like to cover our ongoing phase 1b trial, which is olinbacimab plus pembrolizumab with recurrent GBM patients and also metastatic triple-negative breast cancer patients. First part will be covered for recurrent GBM. As you know, GBM or recurrent GBMs are highly angiogenic tumors and also very heterogeneous. Genentech approached their VEGF-A antibody, which is bevacizumab, with recurrent GBM. And the trial was approved last 2017 December as full approval. However, there is also limitation that they couldn't show any extension of overall survival. 2018 ASCO, a friend of mine, David Reardon and Patrick Wen covered their pembro monotherapy and also pembro-beva combo for recurrent GBM. However, this angiogenesis inhibitor with IO combo has a limited performance in recurrent GBM, quite similar to beva mono alone. And pembro mono patients are suffering under cerebral edema seriously. Nivolumab, another anti-PD-1 antibody, shows recently their limitation in recurrent GBM. Every year when I attend SNO, the Society of Neuro-Oncology conference, people are chatting that recurrent GBM is a public graveyard for all new drug development. It's very challenging tumors. Based on that, PharmAbcine and MSD wanted to challenge recurrent GBM, and we initiated the trial. These studies were running in Australia, one in Olivia Newton-John Cancer Center in Melbourne, and Sir Charles Gairdner Hospital in Perth. In order to determine the recommended phase 2 dose, we adapted the MTPI. Since very comfortable with 12 mg per kg weekly dose for olinbacimab, we fixed with this dose, and we adapted pembro as flat dose, which is 200 milligram every 3 weeks. If there's no toxicity, we go up as a 60 mg per kg weekly dose. And we started with 3 patients in first cohort, and there was no DLT, so de-escalation option was not an option, but we increased the olinbacimab dose up to 60 mg per kg. So this study's primary endpoint is safety. So we'd like to look at whether there's any DLT, adverse events, vital signs, laboratory tests, ECG, and any immunogenicity issues. We also would like to look at efficacy, like overall response rate, disease control rate, progression-free survival, overall survival in RANO criteria. We would like to get all information as much as we can, which is PK, PD, exosome sequencing, immunohistochemistry analysis from tumor, but also any hemangioma tissues if there is any, and change of steroid and severity of brain edema, and change of health-related quality of life. We got the HLA approval October 2018, and first patient came in January 2019. So the first cohort, 12 mg per kg, in Melbourne, we got 3 patients enrolled, 0 dropout, all of them end of treatment. We went to second cohort with 60 mg per kg. We got 3 for Melbourne and 3 for Perth. 2 of 3 got end of treatment, and still 1 patient is ongoing in this trial. Whereas the 3 patients recruited in Perth, all of 3 are end of treatment. 9 patients in total were recruited. 8 patients are end of treatment and 1 in ongoing. In first cohort, we got median 3 cycle between 2 to 6. In second cycle, we got median 6 between 2 to 12 cycles. 53 years old age is normal between 33 and 67. And all 9 patients are male. 8 patients got temozolomide, and also lomustine and carboplatin and procarbazine. 4 patients got first recurrence, whereas 4 patients got secondary recurrence, and 1 patient got third recurrence. There was no metastasis. This is interim data. The data cutoff date is last June. As we expected, we didn't see any DLT, and TAE, all patients, and TAE with CTCAE grade 3, 7 events from 4 patients. And severe adverse events, we observed 6 events from 4 patients, 5 cases seizures, and 1 hydrocephalus, which are very common for recurrent GBM patients. We always observe some hemangioma cases. In this case, 6 patients show that, which is 67%. 15 events are all grade 1, and 1 event is grade 2. There is no grade 3 hemangioma. Interim efficacy data, 4 patients, which is 44%, had a stable disease as best response. 1 patient is staying on stable disease over 12 cycles, currently close to 16 cycles. Median overall survival is 7.2 months, and median progression-free survival is 1.3 months. We think this olenbasimab pembrolizumab combo in recurrent GBM, we can deliver the message that this, although interim result already met the primary endpoints, and there is strong rationale to initiate phase 2 efficacy trial. So the second part of my talk will cover MTMBC. As you know, the KEYNOTE-119 trial, which is pembro combo in MTMBC, unfortunately showed limitation. The study design is almost same like a recurrent GBM I just presented. 2 sites in Australia, 1 in Liverpool Cancer Center in Sydney, and the other one in Breast Cancer Research Center, Harley Private Hospital in Perth. Endpoint, like a recurrent GBM, we would like to see any DLT and adverse effects, ECG, chest X-ray, and any potential immunogenicity. Efficacy, same. Overall survival, we follow the RECIST 1.1 criteria. And like exploratory, we would like to get all information as much as we can. HA approval was October 2018, and first patient came in December 2018. 2 patients in first cohort were recruited in Sydney. Meanwhile, these 2 patients are end of treatment, and 3 patients are recruited in Perth, and 1 patient dropped out, and 2 patients are end of treatment. In second cohort, which is 60 mg per kg, we got the 1 patient in Sydney, and this patient is end of treatment meanwhile, and 5 patients in Perth for second cohort. 2 patients are end of treatment, but 3 patients are still remain ongoing trial. In first cohort, we got the 1 to 18 cycle treated. In second cohort, we got the 2 to 15 cycle treated. Age was 62 years old, 8 years, and all 11 patients we recruited are female. The ECOG performance status 1 is 2 patients, which is 27%, and 0 is 8 patients, which is 3%. Previous anti-cancer therapy history for the patient. First line for metastatic lesion is 6 patients, and previous chemotherapy as 5 patients. This MTMBC patient has also recurrent history. The first recurrence was 7 patients, and the second recurrence was 4 patients. The lesion of metastasis, 7 patients in lung, 6 the lymph node, bone and liver, brain, all 3, and others are 5. Others are adrenal nodules, skin, kidney, chest wall, and thoracic. The interim result, again, no DLT. All patients show TAE, and TAE with CTCAE grade 3 or more, we got 24 events from 5 patients. And grade 3 adverse event related to treatment was 3 events. 2 hypertension, and 1 pulmonary embolism. And severe adverse events, we got the 7 events from 4 patients. Again, 73% of patients show hemangioma, but most of the cases were grade 1 and grade 2. We observed 13 cases. So interim result in efficacy, 4 patients, 36% had a PR as best response, and 1 patient had a CR in target lesion. However, overall PR due to non-target lesion remains still. And 5 patients had clinical benefit, and median progression-free survival is 4.2 months, and the expression level of PD-L1 tissue is under investigation. To look at the tumor volume change by spider plot, in left panel you can see 12 mg per kg olinbasimab, the blue patient, just after 2 cycles, the tumor goes and release. Red patients maintain up to 12 cycle SD, but then the tumor started growing, so released after 18 cycle. The yellow patient, from the beginning, the tumor shrinked. However, there was new lesion occur, so she left after 8 cycle. The green patient, just after 2 cycles, dramatically, about 50% of tumor size shrank, and then maintained up to 8 cycles, and started growing the tumor size, and she was released as PD, I think. And right panel, it was 60 mg per kg with olinbasimab weekly dose. The first, the yellow and the blue, these patients were not responded well. The green, after second cycle, the tumor size shrank and then rebounds back. The blue, she responded very well, and she's doing great currently. Also, purple, the tumor shrinks very well. And then the brown patients, tumors are growing completely gone in target lesion, but there's still a non-target lesion exists. Currently, still 3 patients are ongoing. Same data with swimmer plots. Yellow lane is 12 mg per kg, and blue is 60 mg per kg. And as you can see, this red star designated as PR. Still, it is early to say, but based on the primary endpoint as DLT, we think the trial met the primary endpoint, and this combo showed a clear evidence of positive effects by combination of olinbasimab and pembrolizumab in MTMBC. And we think this efficacy may indicate that olinbasimab plays pivotal role in both as angiogenesis inhibitor, but also immune modulator in tumor microenvironment. So there is strong rationale to initiate phase 2 efficacy trial. I would like to thank to patients, caregivers, PIs, medical staff, CRO, advisors, investors, and especially MSD. Thank you very much.